How much does a hysteroscopy procedure cost? If you're exploring options for fertility or dealing with endometriosis, you might be wondering about the cost of a hysteroscopy. This minimally invasive procedure is used to diagnose and sometimes treat uterine issues that can affect fertility, like polyps, fibroids, or adhesions. The price can vary quite a bit depending on several factors. In the United States, the typical cost ranges from about $2,100 to $7,700. The lower end usually covers diagnostic hysteroscopies, which are simpler and mainly involve examining the inside of the uterus with a thin camera. These are often done in a doctor's office and tend to be less expensive. When the procedure involves surgical treatment, such as removing abnormal tissue or correcting uterine abnormalities, the costs tend to be higher. These operative hysteroscopies might include procedures like removing polyps or fibroids, which can add to the overall expense. Where the procedure is performed also influences the price. For example, outpatient clinics or office-based settings generally cost less than hospital-based surgeries because they often involve less anesthesia and facility fees. Prices can start around $1,000 and go up to about $7,700 if purchased through platforms that offer upfront pricing. In some states like Texas, costs might range from around $4,400 to $6,000. Insurance coverage plays a big role in what you might pay out of pocket. Many private insurance plans and Medicare may cover hysteroscopy if your doctor considers it medically necessary. However, coverage varies depending on your specific policy. Patients without insurance or with high deductibles might need to pay the full amount unless they find financing options or compare prices among providers. From a fertility and endometriosis perspective, hysteroscopy is a key tool. It helps diagnose and treat uterine problems that could be blocking conception or causing recurrent miscarriages. Because early diagnosis and treatment can improve fertility outcomes and sometimes prevent more invasive surgeries later, understanding the costs involved is important. In summary, if you're considering hysteroscopy for fertility or endometriosis issues, expect to pay somewhere between about $2,800 and $7,700 in the United States. The exact amount depends on the complexity of the procedure, where it is performed, and your insurance coverage. Always talk with your healthcare provider and insurance company to get a clear idea of your specific costs and options.